Hello everyone, today we're going to talk about a real case at the office of Dr. Fanny Yacaman. It is a big surprise because it's about a patient that we were treating. He suffers from a mental disease and he came to have a treatment with us. Very well controlled, very nice patient. Let's see it. Well, what you're going to know today is about what happens when a dentist is doing a root canal, and the dentist that referred me this patient is a very good dentist. She has done several root canal treatments. However, when she started doing this root canal treatment, she called me and said, I have a serious problem because I cannot find an extra canal on the tooth. And she knows very well that there's 2 canals in each of these roots in this lower molar. It was extremely infected. It needs to be drained. The patient had a fistula, like a pimple, and it was draining severely on the inside of the gums, and that can be, as you know, extremely dangerous. She placed the patient in antibiotics and came to the office to make the patient feel better. But look at what happened. This is the tooth, and when you enter and you see the canals are calcified, when the canal is calcified, you have to use different techniques, and we use not only gentle wave, but we use a machine, but we use several instruments that are going to help us to find the canal, to locate the canal. We use the microscope, and with the microscope we can have a better visualization and look where the canal can be found. We use ultrasonic machines. We use several instruments that is going to help us, but the canal was next to it, and it was very difficult to see. We have to redesign the opening of the tooth and use a gentle wave machine. This machine is used to open up the calcified canals really good. Also, the company said that it's gonna have an extreme clean canals. It's gonna disinfect the tooth very well. And I use complementary irrigations from the beginning. Your endodontist, you will listen to the endodontist that is gonna be irrigating until the canal is flooded with so much irrigation. So what happens in these cases is we found the canal, and it was extremely infected, so I decided to place a temporary material. And in the temporary material, here's when we were using the gentle wave, but we put a temporary material, and I put antibiotics in the canal. And why? Because I wanted to heal really well, and also I wanted to be sure that the abscess or the little pimple that you see on the mouth is gonna be, healed. So we use several techniques to drain the canal. As you can see here on the screen, we were suctioning, we were draining, and I did not want to leave the pus or finish the treatment when it's an excessive amount of pus still coming out. It's a lot better that your endodontist leave antibiotics inside of the root and another materials that we use, and the next appointment we can finish the treatment. However, I also use another instrument that is called endoactivator, and this endoactivator also works to clean the canals, and is an easy way to use that. The gentle wave machine is more complicated. We use these instruments that are extremely small. They are old-fashioned. Not everything is used with modern technology, because sometimes we used to have we need to use these instruments. So when you see in this case, I have to bring the patient again. Of course, we have to put in the first appointment and the second appointment the rubber dam that you see. We have to design the shape that we're gonna enter. In this case, it was open. We just have a little bit of more design to find the calcified canal. I also use manual irrigation a lot in combination, because there's never enough irrigation that you can use to clean the canals. So also, of course, we use rotary instruments, and in this case, once we found the canal, then we can clean, as you see on the screen, how the bubbling of the several liquids that we make a combination is cleaning. And before we close it on the second appointment, also I use antibiotic to irrigate. It's called MTID. And once it's no bad smell in the canal, no pus, nothing coming out, and it's clean, then we can finish the canal. And we use a material that is extremely good that is called gutta percha. And the gutta percha is going to stay inside of the canals, and that is going to replace what we call the nerve. So now, after all this time, endodontist uses technology, but still we have to use the basic principles and to know the anatomy. This is the important. Remove the decay, and then once we remove the decay and we find the canals, we have to use the irrigation that is going to enter in these little channels that you see on the tooth, and these are called dentinal tubules. And once you clean everything perfectly, then you can finish the canal. Now, the patient have to take antibiotics, and until today, our patient is being successfully treated. We temporize the tooth with Teflon and another material that is called Duralon. Of course, what you see on the screen now is the other machine that I told you that is called endoactivator, and this machine also clean the canals. It has the tips that are longer than you see on the screen, but these tips are what the function is to clean. And we put the irrigation, we put a little liquid, and then we vibrate with this endoactivator, and this start cleaning the canal, as you can see in this example that we have. But this technique and others, what is important is that we clean and clean and clean the canal. And of course, you need to brush and floss, because it doesn't matter how good is a root canal or a crown. If you don't brush and floss at night, or you don't wear a night guard, your treatment is not going to be successful. So technology is really good. We have so many things that facilitate the success of the treatment, that it can be extremely predictable, so you can save your tooth. I call this machine the bacteria killer, because it's extremely good also to clean the canal. So I hope you like this episode, and if you have any questions, please don't forget to contact us, and we will continue explaining to you about this machine and cleaning the canals and preserving the tooth. That is the most important. Thank you very much for your attention.